Meet Mr. Armstrong, a 56-year-old male who has been struggling with alcoholism. He has a 30-year history of alcoholism, and in the last 20 years, he has tried to quit drinking, joined Alcoholics Anonymous meetings, and other alcoholic rehabilitation programs. He successfully abstained from alcohol for 4 months total in the past. He is now in the acute care unit with his wife after noticing yellowing of the eyes and skin, showing jaundice. He has tried several times to quit drinking, but is having a difficult time.
I'm very concerned, honey. Is my face still yellow like it was before?
Oh dear, I'm afraid it's very yellow. It's been 3 whole days now. I thought it was only babies that had problems like this. Let's see what the doctor and the nurse have to say.
Hello, Mr. and Mrs. Armstrong. I'm registered nurse Haley that will be working with you today. Mr. Armstrong, how are you doing today? Could you tell me more about your symptoms so I could relay this information to the physician?
Well, it's a good thing you're here. My skin is as yellow as these bed sheets, and I feel awful.
Yes, we want the doctor to tell us what the problem is. He's been very weak and tired for days, and this jaundice has me very worried. Could you please tell the doctor that we're ready to speak with her?
Okay, I will let the doctor know. She will be here in a moment. However, do you have any pain at the moment, Mr. Armstrong?
I do in my stomach. It's about a 6 out of 10.
Okay, I will get you something for that. The call bell is right beside you if you need anything. And the physician will be in very soon.
Thank you.
Isn't she just the best little nurse, honey?
Yeah, she's okay.
Hello, Mr. and Mrs. Armstrong. I'm Dr. Aniola. How are you doing today?
Been better.
I'll be talking to you about your diagnosis. I hear that you're a bit worried about the situation. Unfortunately, Mr. Armstrong, your diagnosis is pretty critical. You have hepatitis and cirrhosis of the liver, jaundice and ascites as well. The yellow that you see is called jaundice, and it's occurring from the damage of your liver because you're losing a lot of your liver cells due to the cirrhosis.
So you saying my liver's no good?
Unfortunately, yes. So this occurs from the chronic intake of alcohol, and your liver cannot handle it. So now your liver is in the end stage, unfortunately. Let me know if you have any additional questions. In the meantime, Nurse Haley and I will start you on some corticosteroids, and we'll have to look into reducing your alcohol and your alcohol intake, and hopefully we can help altogether, stop it altogether. How does that sound?
I don't even drink that much.
I think we need a little bit of time to discuss this. Thank you, doctor.
I'll begin the treatment now, and I'm here to support you in any way that I can. If you have any concerns, please let me know.
7 days after corticosteroid treatment.
Hello, Mr. and Mrs. Armstrong. Unfortunately, the corticosteroids weren't working well for your husband, and his condition is not progressing as well.
I can't believe his liver is failing. What are we going to do? I can't lose my husband, and you don't even drink that much anymore. Nurse Haley, isn't this an awful situation?
I'm so sorry about the situation. I understand this is a difficult moment for the both of you. Maybe we can talk about resources that are available to you and any concerns you have as well. This might help with coping with the issue at hand.
What about a transplant? I knew my buddy Jack had a friend that had a transplant, and he was able to quit drinking after.
That's an excellent idea, honey. Jack's friend has been so healthy ever since. That's what we're going to do. He's going to have a liver transplant. How do we get on the list?
Okay, doctor, if you wouldn't mind, we could go discuss this privately.
Definitely.
Thank you.
So as you could see, the Armstrongs are very adamant about getting on the liver transplant list.
Yes, exactly. I feel that Mr. Armstrong cannot be placed on the list just because he struggles with alcoholism. However, I'm going to call the Trillium Gift of Life representative, and she can tell us more about that.
That is true. Maybe we can call her and find out, and then come have her speak with us, and we can relay the information on to the Armstrongs.
Yeah, exactly. Thank you.
Hello, Dr. Aniola. Oh, I'm good. How are you? Oh, no. Wow, that patient sounds awful. Yeah, I'll be there as soon as I can. I'll see you in a minute, all right? Okay, bye-bye now. Hello there. I'm Casey.
Hi.
Nice to meet you.
Nice to meet you as well.
Hello.
I'm Haley.
Hi, I'm Aniola.
So we have a situation with a patient, you said.
Yes, we do. We have a patient, he's 56 male, he has cirrhosis, severe hepatitis. The patient wants a liver transplant. Yeah.
Okay. Now, was it the patient's idea for the transplant or was it yours?
It was the patient's idea.
Oh, okay. Do you have the charts for any previous therapy that you've done?
Yeah, we do. We actually tried the corticosteroids therapy for 7 days, but that didn't work well for him.
Oh no, look at these lab values. Okay. Well, so with the laws in Canada, people who are alcoholics must be sober for 6 months before they can be considered to be on the list, and that doesn't even mean that they'll get on the list for sure. But unfortunately, according to these lab values, it doesn't look like this patient even has 6 months.
So,
Yeah, that's very unfortunate.
That is very unfair. Is there any other options for him?
Well, I don't think so. I mean, coming this August in Canada, they're doing a clinical trial showing that they're going to study to see if there's a difference between waiting 6 months of sobriety or starting it right away and not waiting for sobriety. But now that doesn't start for another 4 months, and I don't think this patient has 4 more months. But if you have him until 4 months, give me a call and I'll do everything I can to try to get him into that clinical trial.
okay. Thank you so much.
Oh, of course.
Thank you for meeting with us
You're
today.
welcome.
We appreciate it.
Hello, Mr. and Mrs. Armstrong. How are you today?
We're okay.
Okay, so the prognosis is pretty poor. I spoke to the Trillium Gift of Life representative about your liver transplant suggestion, and we both agree that your lab results are bad and not as great. Sorry, and so we're not sure. Like, we don't think you can be on the transplant. Also, in Canada, the law is that you have to be sober for 6 months before we can put you on the liver transplant list. And unfortunately, I don't think you have that long.
How long do you think I have?
To be honest, I do think you have 3 months, about 3 months to live.
Are you saying that he's dying?
Unfortunately, yes, he is.
So what are our other options then?
There is one other option. It's a clinical trial happening in 4 months, and so in August. But there's no guarantee for that, like that you can be on it and it's also going to work for you, right?
And I might not make it till then, eh?
Exactly.
Well, what else is there then?
So the other option that I would suggest is palliative care. Have you heard anything about that?
No, can you explain that?
So with palliative care, it is a care that promotes comfort measures, and we just try to manage your pain as much as we can. I can actually get Nurse Haley in to talk to you more about that and just let you know your options, and if you want to have it here or at home or whatever you decide.
I think we'd like to discuss it a little bit more, and then we'll let Nurse Haley know.
Okay. Let me know if you have any other questions, okay?
Thank you.
Hello, Mr. and Mrs. Armstrong.
Hi, I think we're gonna go with the palliative care route.
Okay, so there's 2 routes that you can go with the palliative care. You can either stay in hospital and we have palliative rooms, or you can go home and we can have home care come in to help you to provide comfort measures there.
No, I think I want to stay in the hospital.
Okay. I will let the physician know your wishes, and we will set that up for you.
Thank you.
4 weeks later, the patient is on the palliative floor and he has passed away.
Honey, nurse.
Yes, Mrs. Armstrong.
I think he's gone.
I'd like to set you up with the social worker.
Thank you for everything you've done, Haley.
You're very welcome.
You're such a good nurse. I think I really will need the social worker to help me get through this.
I understand.